A spinal cord injury can be anything that stops the spinal cord from working properly. The spinal cord is an extension of the brain. It takes the signals from the brain to the rest of the body and therefore controls pretty much everything, and therefore can affect any part of your body depending on where it is. Because it has such a big impact on people's quality of life, it needs to be managed really properly. And because it can affect all parts of the body, it often involves lots of different members of the team, and it often involves quite complex care, which is why we have a specialist team dedicated to looking after spinal cord injury patients. We have a specialist nurse and some specialist physiotherapy cover, and what they'll be doing is working around all of your cord injury to make sure that you don't develop any complications as a result of your cord injury, but also to get you in as good a shape as possible and to keep you in good shape whilst you're recovering and to give you the best possible chance of having the best possible outcome from your cord injury.
There are 8 spinal cord injury centres in England. And then one of them is in Sheffield Hospital. And our hospital is being commissioned to send our spinal cord injured patients into Sheffield. This hospital has been doing that project since 2021. And in East Anglia, we have 3 spinal hubs: the Norfolk and Norwich University Hospital, Ipswich University Hospital, as well as the Cambridge University Hospital. And in these 3 hospitals, their spinal cord injured patients go to Sheffield.
As part of your care, you will meet the physiotherapist and occupational therapist. During your initial assessment with the physiotherapist, they will ask you lots of questions to determine your level of function and independence before coming to hospital. You will then complete a variety of tests, for example, breathing tests, testing how strong your muscles are and what sensation and feeling you have in your arms and legs. While you're in hospital, you will continue to work with the physiotherapist in order to gain as much independence and function as possible while you await ongoing care. The occupational therapist will set functional goals with you to progress your rehabilitation, as well as reviewing your home environment and, where possible, an access or home visit to start and support the discharge planning process as early as possible.
For some people, the purpose of psychology is really just to speak through what the experience has been like. A lot of, obviously, the jobs of the rest of the team can be quite practical and functional, and actually just having a space to talk about how it's been, for some people that's enough, just speaking through it. For a lot of people, it's about the uncertainty of injury at this early stage that we see people in, so it's quite hard to adjust to what living with an injury will be like when you don't know what it's going to turn out like yet. So that uncertainty is quite hard for people. Sometimes people don't have enough information yet, and that can be quite difficult. But the other thing I actually see people quite regularly about is just the stress, the immediate stress of being in hospital with maybe families who are outside dependent on them. So there's multiple things that can make this a really challenging time for people.
One thing that you'll see and probably already have been subject to is something called the Asia chart. Now, this is just a way for us to document our examination. It's a thorough neurological examination that allows us to see which bits of you are working well, which bits not so well, and which bits not working at all. From that, we can see how your cord injury is changing and whether you're getting better. And we can also communicate that with then Sheffield, and they can be well informed as to how you're doing. And we can use that to guide your ongoing therapy and to make decisions about your ongoing care. So for instance, if you're still recovering whilst you're still on your period of 2 weeks of bed rest, by the time you get to the end of that, it might well be that a longer period laying flat in bed would be beneficial for you to give your spinal cord the absolute best chance of getting that little bit extra back, because who knows what difference that'll make to the rest of your life. And so that little week now might make a difference to the whole rest of your life. And so we do have to sometimes make those decisions to make everything as good as possible.
Usually after 2 weeks, we will ask the patient to have a graduated sitting, wherein it is all assisted by the physios, and once they are sitting upright already, physios will allow them to sit on the edge of the bed, and that they will be ready for early rehabilitation. It's also during that time that we will discuss to you about the spinal cord injury center or your discharge destination, whether you go to rehabilitation or whether you go to local rehabilitation or It could be that you could also go home with a physio input in the community.
Hello and welcome to the Princess Royal Spinal Injury Centre, Sheffield. We provide comprehensive services for patients with spinal cord injuries with facilities for rehabilitation and ongoing care. The centre is the second largest spinal injury centre in the United Kingdom with a large catchment area. In rehabilitation, you are an active member of your multidisciplinary care team. Alongside the 24/7 care provided by the nursing and medical staff, you will receive specialist therapy services and have access to other trust-wide specialties as appropriate, such as urology, psychology, dietetics and speech and language therapy. Your time within our centre is just the start of a lifelong rehabilitation journey following your spinal cord injury. Our aim is to maximise your independence during your stay and prepare you for leaving. We are based at Sheffield Teaching Hospitals, Northern General Hospital. Information on how to get here is available on our website.
After you arrive at the unit, you will meet with a member of the medical and nursing team who will oversee your care while you are at the centre and will continue to provide lifelong support after you are discharged. You may be transferred to an adjacent spinal injuries ward dependent on your care needs.
We know how important family and friends are to your recovery. We therefore encourage family and friends to visit, socialise and learn how best to support you. Visitor parking and limited overnight accommodation is available on site for a small fee. There is also a wheelchair accessible vehicle that visitors can sign up to use and take you out on local trips.
In order to get started in your rehab programme, you need to be prepared to participate right away. Please bring toiletries and comfortable loose-fitting clothing and shoes which are larger than you may normally wear. There are laundry facilities on site for you or your family to wash your clothes.
A typical day of rehab starts as soon as you wake up in the morning. You will work with the team to enhance your function and independence, including practicing personal care and everyday activities like meal preparation, washing and dressing, and getting in and out of bed. If you cannot achieve these tasks physically, then we aim to teach you to be verbally independent in directing your care.
As soon as you get here, nurses, doctors can come to see you. The physio's first day, physio comes to see you. The OT, Kim, comes to see you. Everyone came to see you, gave you all the details and outlined plan. You get here and then they go, right, you're going to do this, 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 this. All progression to going home. And they use the home, obviously, that's the carrot, that's the, to get you, because that's what you will need to get home into it and just get back to normality. I've never even sat in a wheelchair before. So everything from learning how to sit in it, use it just every day, even something stupid as touching the floor, leaning forward, being scared that you might fall out of the chair, but you could just confidence building. And then they do everything from transfer from your chair to your bed, to a car, so then you can start going out. They do everything. So they tick every box. To get your sitting balance is a big thing here. So to get on from your chair to a plinth, like a bench, then be able to sit upright by yourself without, and just being able to balance yourself, because that balance has sort of gone a little bit. So it's just one of them things that keep training, keep doing it. Never perfect, but the work just keeps going and going and going. So
everybody going through the same thing, you know what I mean? So I'm watching how people are progressing. So that game, it encouraged me then to progress, you know what I'm saying? So that's what it is.
On the count of 3 then. 1, 2, 3.
Oh man, it's benefiting me a lot, trust me. It is. My legs, I can move my legs, I can bend my knees. You know what I mean? So I'm progressing a lot. It's very good.
Yeah, you're meeting different people every day. There's always somebody new coming onto the ward, and then somebody else moves off, but you make another friend.
Initially, when a patient comes in and they've been seen by the doctors and the nursing staff, OT and physio staff will undertake our own assessment of the patient, and from that we'll then talk to the patient about what their achievable goals can be for the short term and for the long term, and then hopefully set a programme to achieve independence. I think the biggest benefit for patients coming here is not only having access to all our facilities, but having peer support from other patients, from other relatives, and from the different charity members who come into the centre to support the patients.
The staff, I think, have been absolutely brilliant to me personally. They talk to me and I can talk to them about any problem I've got, and they're teaching me things that I didn't know about wheelchairs, and also they're putting me in the right situations for when I get home. There's other things I've got to look at and take care of myself, so I'm learning all these things from them. So I'm absolutely chuffed to bits with them here. They've been brilliant. I'm always on the mindset that I'll be walking again because of the way they've repaired me and the work I'm doing. I can see myself walking again. But you've got to be on that goal. Just keep trying what you've got to do, push yourself, and can things get altered? But sometimes you know they can't be altered. But at times you just keep trying your best, and that's all you can do. That's all you can do.
For entertainment, we have a dedicated patient activities coordinator who offers one-to-ones and weekly group sessions such as bingo, yoga, and an arts group which you may choose to participate in. We have an accessible minibus that staff may use to take you out on trips in the local area. You will also have access to a dining room and balconies that offer a place for you to eat and socialise with other patients and friends and family. The dining room also provides access to computer facilities, TV and DVDs, books and games. The centre has free Wi-Fi, a relaxation space for calmer moments, and a personal TV. We also have a number of volunteers from different charities who are available to meet with you. This includes a benefits advice service.
You may also meet the psychologist who, along with the rest of the team, will help you in dealing with your adjustment to living with a spinal cord injury. Talking about how you and your family are coping with the changes in your life might be helpful.
We know that patients and their families have many questions about returning home and how long you will stay. Your estimated discharge date will be set by the team soon after you arrive. There is an assessment flat that may be available and appropriate for you and your family to spend some time in prior to discharge. This will allow you and your family to put into practice the skills you've learned whilst rehabilitating. Once you leave the centre, we will continue to support you by providing lifelong advice and follow-up appointments in our outpatient department.
We hope this gives you a better idea of what to expect from your stay, and we are more than happy to answer any further questions you may have. Please call our friendly reception on 0114 22 693 12.
I think a lot of the patients have been through quite a challenging experience in their lives. And while often that experience is sort of in a position where sometimes things, unfortunately, you can just do what you can do to help, you often see patients and you see that vast improvement, and there's a definite pathway of patients sort of not only coming to terms with what's happened, but looking at how they can move forward with their lives. Also, when you often see our patients, that will actually, you'll see that improvement through therapy, through the change of things, and learning a new way of becoming independent, just from taking on that experience on board and actually moving forward with that challenge.
Everyone, they've been so helpful and so driving as well. There's never been a negative thing said to me, because they know I'm determined, so they've always tried to stimulate that determination in me doing something, and I just think they're brilliant, absolutely brilliant.
I know it's a bit of a weird bit, but it's more human now, if you know what I mean. Instead of just being laying in a bed all the time, now I'm actually active. Do this, do that, play sports, been in a swimming pool, done all sorts of stuff, so the comparison isn't even, there isn't one really. How long I've been here? 5 weeks. It's massive. So, and everything is just, it's all confidence inspiring. And we just need confidence just to get through it, really.
I think the most important thing I learnt in Sheffield was that rehabilitation is the start of the journey. It's not the end of the journey. You have to accept your disability and accept that it doesn't have to get in the way of life. There are endless solutions to the various different problems that you face in life as a disabled person, and you know, Sheffield was as important to me in terms of my mental rehabilitation as my physical rehabilitation. The overall rehabilitation experience in Sheffield, the attitude towards helping you adjust and normalise life with a disability is really what makes the difference. That I always said that the Sheffield experience is the NHS at its best. Everybody from the cleaner to the consultant is working together as a team on your rehabilitation, and you're a part of that team, and that's what makes it the complete rehabilitation experience.